Good morning, conference, or good afternoon, or possibly good evening, depending on how it's going. As part of primary care services, the only service dentistry ever receives is lip service, and this situation can't continue. The idea of holistic healthcare is relatively recent, but for it to work, everyone has to be on the same page. For the vital link between oral and general health to be understood by our patients, it needs to be incorporated into healthcare initiatives, and it needs to be acknowledged fully by government. And if it's acknowledged, it must be supported. NHS dentistry needs the same level of commitment and support as all other healthcare services have. The only reason not to provide this is financial. Contract reform stumbled at the gates of the Treasury, and NHS dentistry is not free at the point of delivery for purely financial reasons. We know how suspicious the government and the Treasury are of dentistry. The overwhelming majority of us have some form of NHS commitment alongside private commitment, and the private work usually subsidises our NHS work. But further underfunding of NHS services will become an impossible burden for all of us to bear. That subsidy will become completely impossible. NHS dentistry is stretched to the point of fracture. There is nothing more to give. We cannot give any more. Failure to acknowledge NHS dentistry as part of NHS primary care at this crucial point in the nation's health and wealth would be confirmation of the government's abandonment of NHS dentistry. It would threaten our patients, and it would threaten all of us with any NHS commitment. Acknowledging dentistry as an integral and vital part of primary care services and financing it and supporting it properly would support us all. It would support NHS practitioners, private practitioners, and our patients. Please vote for this motion. It matters. Thank you.
Right. Well, once again, we don't have anybody with their hand up wanting to speak for or against, or even on the motion. Just give it a minute or two. Right, here's the vote. It's all right, Ben, I'll put the vote there. And this, of course, is UK-wide. This is policy, so everybody gets to have a go.
Sorry, Stuart, got a bit trigger happy there.
That's all right.
Don't forget to press submit. I think we are there. There you go.
Right, well, unsurprisingly, to me, that's been carried by a massive majority, 96% for, 3 against, with 1% abstaining. So thank you very much for that.
In my after dinner speech last year, I made reference to a number of issues, some which irritated many within the establishment. One of the themes I touched on was this business of prevention being deemed a panacea for all dental care. Prevention is very important, no doubt, but treatment of dental disease is equally important, and this must be carried out by all, and we need to be paid appropriately for this. Treatment of dental disease and the prevention of dental disease are inextricably linked. In practices like mine, there is a great flux of patients. Some admittedly are poor attenders, and frankly many have social issues associated with deprivation, which does mean that their dental health is sometimes neglected. They are not the worried well. Many have genuine dental problems and need a lot of treatment. Year after year, the foundation dentists in my practice are shocked to see bite wing radiographs showing 5, 6, 7, 8 cavities. So dental disease is not a thing of the past, despite what some will have you believe. It is still prevalent in many communities, and many of us treat these patients on a daily basis, despite an unfair system of remuneration within the NHS. The government needs to recognise the importance of dental health and the role that our teams play in delivering this care. If it means a core service, then so be it. But they need to stop talking about the fluffy stuff that reads well but means nothing in the real world. The advisors to the government need to come and spend some time in practices that serve the most deprived sections of society. This motion is a no-brainer, and if anyone chooses to vote against it, please don't hide behind your screens. Tell me why. Thank you for your support. Stay safe. Bye.
Well, against, oh, right, I was going to say again, nobody's put their hand up, but Ian Gordon has. Ian, are you speaking for or against this motion?
Absolutely for. Vijay, I couldn't agree more. Follows on from what I said earlier about the need to have the ability to flex according to individual practice circumstances. We have to, of course, support prevention, and capitation absolutely has a place, but we absolutely have to have a system that rewards treatment of disease. You cannot prevent what is already diseased. What is diseased needs treating. And one of the biggest failings of the 2006 contract has been the perverse incentive that turned a high need patient from someone who was desirable in a practice to one that was not desirable in a practice. If we don't address that elephant in the room, we won't make any progress in treating the disease which is already prevalent, particularly in high needs areas. I know that's a challenge, and I know it's slightly against the 100% capitation agenda, but I have to completely agree with you, Vijay. We've got to have something that rewards activity or at least allows activity to be done without being penalised.
Thank you, Ian. Does anybody else wish to speak? Let's give it a moment. No, in that case, Binal, may we have the poll? Please remember to click submit when you've voted.
There are 2 hands went up quickly towards the end there, just as the vote was coming up.
Ah, sorry. Right. They
did come up as the vote was getting raised.
So shall we, at that point, as we haven't got the results, Binal, is it possible to do that one again? Let the other people speak?
I absolutely can do again.
Okay, right. So we're going to take a vote in a minute because it's just showing us Nick on my screen from Bromley, Bexley and Greenwich. Nick, do you wish to speak for or against?
Absolutely for. I just remind everybody that the more we hear about prevention, the more we end up with the powers that be paying for extraction. So whenever prevention's talked about all the time, we just very rarely get paid for it. So I think that needs to be remembered by everybody.
Oh, thank you very much. I like a laid-back contributor. That looks superb, I've got to tell you.
Well, I'm afraid I've got a bad back, so I've been lying on my back for the last couple of days, so excuse me.
You have my profound sympathy. Right. Also, we have a GDPC member, John Milne, who of course brings extra things to this particular party, who wishes to speak. John, are you for or against?
Yeah, I'm for the motion, but I'm struggling with the camera, so bear with that. I just wanted to remind conference something that we've often said from GDPC around core service. Those who think that a core service will remain with the same money are deluded. A core service means core funding. Now, obviously, there are lots of people who need treatment. Those of us who work in deprived areas, we're all too familiar with that. So the funding pot needs to be sufficient to meet the real needs. We've all argued for years that the funding's not enough. Government can afford what government wants to afford. They've thrown billions of pounds at various things during the current COVID crisis. The cost of the NHS dental budget is peanuts. If they want it, they can afford it. If they should want it, our job is to persuade them. Thank you.
Well, thank you for that, John. Now, does anybody else wish to raise their hand and speak? You muted me, Binal. I was just asking if anybody else wished to raise their hand.
Was it me?
Oh, sorry, it said host, so I assume that was you. Right, in that case, please can we move to the poll? So right. Even if you voted before, vote again.
Thank you.
And remember to press submit. So not quite unanimous, 96 in favour, 1% against and 3% chose to abstain.
This is William Sidhu, Secretary of Coventry Local Dental Committee. I just want to introduce the motion we have in front of us. The contracting of services should utilize flexible commissioning principles to facilitate the provision of such services as soon as possible. The reason this motion has been brought forward is because of the inflexibility of the present contracting services, whereby sometimes we get phone calls from even former patients who have been in housebound or bedridden and also in care and nursing homes. And in order to facilitate urgent care for them, the general dental services should be able to provide this urgent care on a domiciliary basis and also be remunerated for that. At the moment, the system is such that these cases have to be referred, and subsequently these elderly people sit on waiting lists for a long period of time, and sadly we had one case which even passed away without being seen by the referred services. So yes, we will still need specialized services for patients who cannot be treated in the general dental services, but at least the urgent care could be provided for them, and this could be accounted through the general dental services. So therefore, I want everybody to consider this motion carefully and please accept this motion in providing urgent or domiciliary care to patients who are in care homes, nursing homes, or are housebound, and therefore we have a great provision between the general dental services whereby these patients can be seen, whereby sometimes the services which provide the service on a referral do not have adequate resources to provide this domiciliary care, and this has been highlighted in the present pandemic situation. And also, it has been an ongoing situation previous to this as well, where these people have had difficulty obtaining dental care. Thank you very much.
Right. Now, do we have anybody? Oh, no hands up at all there.
Should we give it another minute?
Yeah, yeah. I'm waiting carefully.
No, I think.
No, I think we better move to the vote, please, Binal.
There you go.
This is, of course, England and Wales. Please remember to press your submit button when you finish.
They're getting quicker, Stuart.
Mm-hmm. Practice makes perfect.
Just the last few. There you go.
So there we are, overwhelmingly carried, 87% in favour, 6% against, with a 7% abstention rate.